Is a relation to oral surgery. What is the diabetes mellitus? A DM, commonly known as a diabetes, is a group of metabolic disorder characteristic by high blood sugar level over a prolonged period of time. Its symptoms include frequent urination, increased thirst, increased appetite. If left untreated, diabetes can cause many complications. Acute complications include diabetic ketoacidosis, hyperosmolar, hyperglycemic state, or death. Serious long-term complications include cardiovascular disease, stroke, chronic kidney disease, foot ulcer, damage to nerve, damage to the eye, and conjunctiva impairment. Diabetes is either pancreas not to produce enough insulin or the cell of the body not to respond properly to insulin produce. There are three main types of diabetes. Type 1 DM results from pancreas failure to produce enough insulin due to loss of beta cell. This form was previously referred as insulin-dependent diabetes mellitus. While type 2 diabetes begins with insulin resistance, is a condition in which cells fail to respond to insulin properly. As the disease progresses, a lack of insulin may be also developed. This is referred as non-insulin dependent diabetes mellitus or adult-onset diabetes. The most common cause is combination of excessive body weight or insufficient exercise. Gastrointestinal diabetes, a third form, which occurs when pregnant women without a previous history of diabetes develop a high blood sugar level. A sign and symptom. A classic symptom of untreated diabetes is united weight loss, polyuria, polydipsia, and polyphagia. Symptoms may develop rapidly, week or month in type 1 diabetes, while they usually develop more slowly or may be subtle or absent in type 2 diabetes. Several signs and symptoms can mark the disease, and they are not specific to the disease. They include blurred vision, headache, fatigue, and the slow healing of the cut and itchy skin. Treatment and management concentrate on keeping blood sugar level close to normal without causing low blood sugar. This can usually be accomplished with dietary change, exercise, weight loss, and use of appropriate medication, insulin or oral medication. Type 1 diabetes managed with insulin injection, while type 2 treat with medication with or without insulin. Insulin and some oral medication can cause low blood sugar. Weight loss surgery in those with obesity is sometimes an effective measurement in those with type 2 diabetes. Gastrointestinal diabetes usually resolves after the birth of the baby. Diagnosis is characteristic by recurrent persistent high blood sugar. This diagnosis measured by one of these methods. The first one, fasting plasma glucose level يكون أكبر أو يساوي 7.0 مليمول على اللتر. The second one, plasma glucose يكون أكبر أو يساوي 11.1 مليمول للتر. 2 hours after 75 gram oral glucose load as in glucose tolerance test. glycate hemoglobin يكون أكبر أو يساوي 48 مليمول للمول. A positive result in absence of unequivocal high blood sugar should be confirmed by repeat one of this method in other day. It's preferred to measure fasting glucose level because it's easy of measurement and is considered a time commitment of formal glucose tolerance test, which take 2 hours to complete and have no advantage over the fasting test. According to the current definition, two fasting glucose measurement above 7.0 millimole per liter is considered diagnostic for diabetes mellitus. Complication of DM. Complication can dramatically impair the quality of life, causing long-lasting disability. Some non-modified risks, such as the age of diabetes, onset, type of diabetes, gender, genetic, may influence the risk. Other health problems compound the chronic complication of diabetes, such as smoking, obesity, high blood pressure, elevated cholesterol level, and lack of regular exercise. Major long-term complications relate to damage to the blood vessel. Diabetes doubles the risk of cardiovascular, like coronary artery disease. Other macrovascular disease include stroke and peripheral artery disease. The primary complication of diabetes due to damage in a small blood vessel include damage to eye, kidney, or nerve. Damage to eye, known as diabetic retinopathy, is can result in gradual vision loss and eventually blindness. Damage to kidney, known as diabetic nephropathy, can lead to tissue scarring, urine protein loss, and eventually chronic kidney disease. Sometimes require dialysis or kidney transplantation. Damage to nerve of the body, known as diabetic neuropathy, is the most common complication of the diabetic. The symptoms can include numbness, tingling, pain, altered pain sensation, which can lead to damage to the skin. Diabetes-related foot problems such as diabetic foot ulcer may occur and can be difficult to treat, requiring amputation. Additionally, proximal diabetic neuropathy causes painful muscle atrophy and weakness.
People with diabetes who have irregular blood glucose level have a higher risk للtooth problem والgum disease. هذا بسبب إنه راح تكون عندهم lower resistance للإنفكشن. الباثوفيسيولوجي مال oral manifestation عندنا تو ميكانيزم. أول ميكانيزم هي البولي باثوي اللي راح يحول لنا الجلوكوز إلى إنزيم السوربيتول عن طريق aldose reductase اللي يسوي لنا tissue damage and numerous complications. الباثوي الثاني هو formation of advanced glycosylation end product whose formation اللي يجينا نتيجة ارتباط الجلوكوز to البروتين and lipid and nucleic acid اللي راح يسوي لنا تغير بالstructure and function. In addition بالإضافة إلى ذلك deposition in specific organ اللي يسوي لنا العديد من الcomplication. Atheroma deposition are formed in cell ويسوي لنا accumulate بالبasal membrane and lemon causing decreased cellular defense capacity and impaired polymorphonuclear leukocyte response. هذا راح يسوي لنا الدايابيتك بيشنت أكثر عرضة للإنفكشن، خصوصا الإنفكشن اللي تكون جاية من الأنأيروبيك بكتيريا نتيجة reduction of oxygen diffusion through الكبد. The first sign and symptoms of diabetes can occur in the mouth. The most common oral health problem affected people with diabetes are periodontal disease, gum abscess, tooth decay, fungal infection like thrush lichen plants, inflammatory autoimmune skin condition, ulcer stage disturbance, dry, burning mouth, low saliva level. Diabetes and periodontal gum disease. Signs and symptoms of gum disease including red swab, the persistence of discharge coming from the gum that are loose and pull away from the teeth, and bad taste or bad breath. Gum disease is more common and more severe in people with suboptimal blood glucose level. This is because they generally have lower resistance to infection and reduced health capacity. Periodontal disease has been reported with increased prevalence and severity in patients with type 1 and type 2 disease. Numerous risk factors have been reported that make patients with diabetes more to periodontal disease, especially those with poor oral hygiene, poor metabolic control, longer duration of diabetes, and who are smokers. Simple chewing can cause systemic dissemination of periodontal pathogen and their metabolic product in patients with periodontal disease, causing endotoxemia or bacteremia, which result in an increase in serum level of an inflammatory mediator, such as interleukin-6, fibrinogen, and CRP. Systemic inflammation can exacerbate insulin resistance and therefore the management of diabetes. For this reason, corrected periodontal treatment can lower the level of a pro-inflammatory mediator and so contribute to better glycemic control. It has been suggested that there is a degree of synergism between DM and periodontal disease. On the one hand, the severity and the prevalence of periodontal disease increase in diabetes and is worse in diabetic with poor glycemic control. On the other hand, periodontitis may exacerbate diabetes, decreasing glycemic control. However, there is some controversy over this issue. Diabetes clearly with an increased blood glucose level, people living with diabetes may have more glucose in their saliva and very dry mouth. The rare condition allows dental plaque to build up on teeth, which lead to tooth decay and cavities. The treatment cleaning your teeth and gum twice daily with toothbrush and fluoride toothpaste. Use interdental cleaner or dental floss daily to clean between your teeth. Now we talk about diabetes and xerostomia. Tendency of salivary flow to decrease was observed when hemoglobin A1C value increased. Furthermore, urea and glucose level in saliva were higher in diabetic than healthy subjects. This suggests that DM can cause xerostomia and may relationship between a degree of xerostomia and glucose level in saliva. Glucose promotes the proliferation and colonization of bacteria in the oral cavity, and glucose in the bases of candida developed and decrease the activity of a neutrophil. Test detection follow a hereditary pattern, but can be influenced by appearance of neuropathies. When this sensory dysfunction occurs, it can inhibit the ability to maintain a proper diet and can lead to poor glycemic control. Taste alteration has been associated with diabetes and development of obesity. Burning mouth syndrome is characterized by a burning sensation in the oral mucosa and absence of a clinical sign. Its etiology includes systemic, local, and psychological factors. Stress, anxiety is more common in women, and the average age of the typical burning mouth syndrome patient is 50 and 60 years old. Patients with diabetes often have burning mouth syndrome, but a clear relationship between the DM and this syndrome has not been identified.
Patient management. All patients with diagnosed diabetes must identify by history and the type of medical treatment they are received must be established. The type of diabetes type 1 or 2 should be determined and the presence of complication noted. This provides the dentist with information regarding the severity of diabetes and the level of control that has been attained. Preoperative. In well-controlled diabetes patients use anxiety reduction protocol but avoid deep sedation. Morning appointment should be given. Patients should come with normal breakfast taken and normal regular dose of insulin taken. Patients with complications or treated with insulin or who are not under good medical management should need to manage it in a special way. If diabetes is poorly controlled, fasting blood glucose under 70 mg per deciliter or above 200 mg per deciliter and any complications, post-myocardial infarction, renal disease, congestion, heart failure, old age, blood pressure above 180, PR 110, all dental procedures should be postponed. Provide only emergency care. At the clinic, immediate treatment should be provided. A source of glucose such as orange juice should be present in the dental office to avoid hypoglycemic attack. Maintain verbal contact with the patient during surgery. A traumatic extraction. Advise patient to inform dentist or staff symptoms of insulin reaction occur during dental office. If any sign or symptoms are present, the dentist should check the glucose by glucometer, establish airway, breathing, and circulation. Place the patient in supine position. If the patient is conscious and she is able to take her food by mouth, so give 15 grams of the carbohydrate in the following forms: orange juice, 3 to 4 tablespoons of sugar, a small amount of sweet or honey. It can be placed in buccal fold. In unconscious patient, take 50 ml of the dextrose in 50% of the concentration, or 1 mg of glucagon IV, or 1 mg of glucagon intramuscularly. The signs and symptoms of hypoglycemia should be resolved in 10 to 15 minutes. Post-operative. If the patient is not able to eat after the dental procedure, so he is recommended to eat the soft food and liquids. Antibiotics should be given after surgery. The goal of dental management of the diabetes is to prevent insulin shock. Management of insulin shock when occur. Most common diabetic emergency which dentists encountered is hypoglycemia, leads to life-threatening, occur when concentration of blood glucose drop below 60 mg per deciliter. Any infection should be treated with the use of the standard method. Warm intraoral rinses, incision and drainage, pulpectomy, extraction, and antibiotics. Local anesthesia and epinephrine. Epinephrine has a pharmacologic effect opposite of the insulin, so blood glucose could rise when the use of epinephrine. In diabetic patients with hypertension, myocardial infarction, cardiac arrhythmia, equation may be indicated with epinephrine and treatment. There is no non-preventive measure for type 1 diabetes. Type 2, which accounts 85 to 90 of all cases, can be prevented or delayed by maintaining normal body weight, doing physical activity, eating healthy diet. The physical activity more than 90 minutes per day reduces the risk of diabetes by 28%. Dietary changes and effects in helping to prevent diabetes, including maintaining a diet rich in grains and fiber and choosing good fats found in nuts, vegetable oil, and fish. Limiting sugary beverages and eating less red meat and other sources of saturated fat. Smoking is also associated with an increasing the risk of diabetes and its complications. Thank you.